Good day, this is Professor Will, CBMD PhD. Today is Wednesday, June 17, 2020. It is 3:11:48 seconds a.m. Eastern Standard Time, and this is a continuation of my Corona series. So let's get started here. Researchers identified potent antibody cocktail to treat COVID-19. Publication highlights process for yielding array of human antibodies that target protein on virus. Date June 16, 2020. Source: University of Maryland School of Medicine. Researchers evaluated several human antibodies to determine the most potent combination to be mixed in a cocktail and used as a promising antiviral therapy against the virus that caused COVID-19. The study demonstrates the rapid process of isolating, testing, and mass-producing antibody therapy against any infectious disease by using both genetically engineered mice and plasma from recovered COVID-19 patients. The antibody cocktail evaluated by UMOSM researchers will be used to treat COVID-19 patients in a clinical trial that was launched last week. Antibodies are proteins the immune system naturally makes in response to foreign invaders like viruses and bacteria. Antibody therapies were first tried in the late 19th century when researchers used a serum derived from the blood of infected animals to treat diphtheria. To produce the so-called monoclonal antibodies for an antibody cocktail to fight COVID-19, the researchers first needed to identify which antibodies fight the novel coronavirus most effectively. This involved determining which antibodies could bind most effectively to spike the protein found on the surface of SARS-CoV-2, the virus that causes COVID-19. The team of researchers evaluated thousands of human antibodies from plasma donations from recovered COVID-19 patients. They also generated antibodies from mice genetically engineered to produce human antibodies when infected with the virus. The ability of the research team to rapidly derive antibodies using these two methods enabled us to screen their selected antibodies against like viruses to determine which had the strongest antiviral effects. Researchers at the UMSOM colleagues evaluated 4 of the most potent antibodies to determine the potential of each one to neutralize the SARS-CoV-2 virus. They identified the 2 that would form the most powerful mix when used in combination. An important goal of this research was to evaluate the most potent antibodies that bind to different molecules in the spike protein so they could be mixed together as a treatment. The cocktail containing the 2 antibodies is now being tested in a new clinical trial sponsored by Regeneron that will investigate whether the therapy can improve the outcomes of COVID-19 patients, both those who are hospitalized and those who are not. It will also be tested as a preventive therapy in those who are healthy but at high risk of getting sick because they work in a healthcare setting or have been exposed to an infected person. This particular research not only contributes to a potential new therapy against COVID-19, but could have broader implications in terms of the development of monoclonal antibody therapies for other diseases. Teravolt registry tracks outcomes among thoracic cancer patients sickened by COVID-19. Date June 16, 2020. Source: Vanderbilt University Medical Center. Summary: new data from Teravolt, a global consortium that tracks outcomes of people with thoracic cancers affected by COVID-19, offers clues to why they experienced a high death rate of 33% when the coronavirus swept across Europe. While the majority of those who died were hospitalized, only 9% were admitted to intensive care units, according to the study published by Lancet Oncology. Most died from complications of COVID-19, not the progression of cancer. Just having a lung cancer diagnosis in and of itself shouldn't exclude patients from care. The study is based on the first 200 patients for which Teravolt received outcomes data. Of the 152 hospitalized patients, 134 or 88% met the criteria for ICU admission, but only 13 of those patients were admitted to an ICU. Only 5 were mechanically ventilated. Most of those patients were hospitalized in Italy, France, and Spain, which were particularly hard hit by the pandemic, the study noted. We tried to capture the reasons for the lack of ICU admission, the authors noted in the study. Difficult decisions were made limiting ICU admission to cancer patients and others with terminal illness due to equipment and personal shortages. However, we are aware that behind these choices, there may be also patients' decisions, cultural and institutional choices that our work is unable to properly capture. Note: not all lung cancer patients are at risk of hospitalization. Initial data indicated that patients on tyrosine kinase inhibitors appear to be at decreased risk for hospital admission. This remained true when the Horn presented updated data from the Teravolt registry last month at ASCO20. That data revealed that patients treated with chemotherapy within 3 months of COVID-19 diagnosis had a significantly increased risk of 64% of dying from the coronavirus. Patients treated with anticoagulants to prevent blood clots and corticosteroids to reduce inflammation also had a greater mortality risk. Patients treated with immunotherapies had no increased risk of mortality. In the Lancet Oncology paper, the authors noted that at this point it remains unclear if intubation and more aggressive care could improve survival for people with thoracic cancer sickened by COVID-19. But the integration of patients' preferences could provide guidance for clinicians while uncertainty is high. The TerraVault registry is an ongoing longitudinal study. Data collected from consortium participants across the globe are entered on REDCap database hosted by Vanderbilt. The registry recently received $95,000 in funding, support from the International Association for the Study of Lung Cancer on behalf of the Lung Ambition Alliance. COVID-19 pandemic can decimate outdoor environmental science educational programs. 11 million children at risk of losing access to educational and health benefits of outdoor education. Date June 15, 2020. Source University of California, Berkeley. Summary. A survey of 1,000 outdoor education programs nationwide finds that nearly two-thirds are in danger of folding because of the COVID-19 pandemic. Such programs connect youth with the world around them and teach about nature, with documented academic, health, and social benefits. But most programs are conducted by residential outdoor science schools, nature centers, parks, and zoos, not in traditional classrooms. The loss will be felt disproportionately by students of color and low-income students. The COVID-19 pandemic threatens the survival of organizations nationwide that provide critical outdoor environmental and science education to K-12 students, with an alarming 63% such groups uncertain about their ability to ever reopen their doors, according to the study released this week by the Lawrence Hall of Science and University of California, Berkeley. By the end of May, the study's author estimated some 4 million youth had missed the opportunity to engage in these programs. This number could rise to 11 million by December 2020 if these organizations are unable to reopen. The impact in California is even higher than nationally. The loss of outdoor education is a devastating situation with potentially catastrophic impact. Getting youth outside, connecting with the world around them, and learning about nature have many documented academic, health, and social benefits. And most of outdoor education is conducted by residential outdoor science schools, nature centers, parks, and zoos, not in traditional classrooms. This is happening at a time when public health leaders are promoting the value of outdoor learning as safe, engaging, effective, and essential. The outdoors is a resource for learning, engagement, and health, and it should be available to all. The loss will be felt disproportionately by historically marginalized groups, particularly students of color and students from low-income families, that are most likely to lose environmental education within their local school districts. Years of efforts to increase access to the benefits of learning and thriving in the outdoors could be undone, even if environmental and outdoor science education programs manage to reopen. Resource-strapped organizations tell us they will need to forego initiatives to promote equitable and inclusive workplaces and even perhaps to halt subsidized programming, scholarships, fee waivers, transportation grants, and community partnerships in favor of paying customers, which could lead once again to exclusive of low-income students and students of color. There are things we can do now to prevent that. The study authors received nearly 1,000 responses from 49 states and the District of Columbia, with the majority of respondents coming from nonprofit organizations 62% and our public governmental organizations 35%. Such programs serve as a wide range of learners in areas including science, environmental literacy, conservation, youth development, community building, social emotional learning, career and job skill development, and environmental justice. In the policy brief, the authors estimated that by December 31st, 2020, some 11 million kids who would have been served by 1,000 organizations will have missed environmental and outdoor science learning opportunities. About 60% of them are from communities of color or low-income community. The 1,000 organizations surveyed will have lost about $600 million in revenue. About 30,000 employees will have been laid off or furloughed from these organizations. It is highly likely that 37% of these organizations in California and 30% nationally will not reopen. Over one-third of the outdoor education field, up to 65%, will likely have disappeared, eroding a key component of the nation's education infrastructure. The policy brief suggests ways to mitigate the potential losses through funding priorities and international coordination of efforts with local and state education agencies. The ideas include redeploying outdoor educators to work in K-12 school settings to increase the capacity of the schools to educate students while following social distancing guidelines. Such partnership arrangements could expand the space limits of schools and help them achieve learning goals while allowing parents to return to work in providing educational, health, and social benefits to students. The authors also suggest that financial aid be preferentially allocated to efforts in marginalized communities to prevent the loss of gains made toward broadening participation in the field of achieving greater equity, inclusion, cultural relevance, and social justice. Outdoor science and environmental learning organizations are an essential part of the education system. They offer solutions to challenges that schools are currently facing as a result of COVID-19 pandemic. They need to be considered as key partners in developing funding priorities, health policies, and guidelines for opening schools and delivering educational programming. It is our hope that this policy brief will help inform these decisions, while underscoring the importance outdoor learning plays in meeting educational and societal goals. Written thanks is Professor Will, CBMD PhD on infectious disease, molecular microbiology, and pathophysiology. We'll hope you enjoy listening. Until next time, have a great night.